Hello ma'am, I am Noreen, your nurse for today. So for today, I will be assessing your peripheral and vascular system. So it is necessary to do an assessment or an examination of the peripheral and vascular system for us to be able to see how normal your blood flow is and if your nerve pulses are normal also. So for this assessment, I am asking for your 100% cooperation. So before we start, I will first perform hand hygiene for infection prevention. And close the door for your privacy. So, I will now start the assessment by asking you some questions if you have any history of the following. So, do you have past history of heart disorder?
No.
How about varicosities?
No.
Arterial disease?
No.
Hypertension?
No.
How about your lifestyle habit? How often do you do an exercise?
I do exercise for about 15 to 20 minutes in the morning, and I do a jog for 45 to 60 minutes in the afternoon.
Okay. So do you smoke?
No.
Do you drink alcohol?
No.
Okay, ma'am. So now I'm going to assist you to a supine position with your head slightly elevated. Okay, so now I am going to palpate the peripheral pulses on both sides of your body, starting with your brachial and then followed by your radial pulse to determine the symmetry of your pulse volume. So I will now begin to palpate. Okay, so I don't have difficulty palpating your peripheral pulses, so I don't have to use Doppler ultrasound probe. And I can see that you have symmetric pulse volume and full pulsations, and I don't see any abnormal deviations like asymmetric volume, which indicates impaired circulation, and I don't see absence of pulsation, which indicates arterial spasm or occlusion. Now, I am going to inspect your peripheral veins in your arms and in your legs for the presence or appearance of superficial veins when your limbs are dependent and when your limbs are elevated. So I am now going to inspect when your limbs are dependent. And now, when your limbs are elevated, can you please, ma'am, lift your right arm? Your left arm, ma'am? Your right foot, ma'am? Your left foot, ma'am? Okay, so I can see that in dependent position, there is a presence of distension and nodular bulges at your calf, which is normal. And in elevated position, I can see that your veins collapse, which is also normal. And I don't see any abnormal deviations like distended vein in your thigh or in your leg or on posterior lateral part of your calf from your knee to your ankle. Okay, ma'am. So now I am going to assess your peripheral leg veins for any signs of phlebitis, starting with the inspection of your calf for redness and swelling over your vein sites. Okay, ma'am, so I'm done inspecting. I am now going to palpate your calves for firmness or tension in your muscles and for any signs of edema over the dorsum of your foot and for areas localized warmth. So palpation augments inspection findings, particularly in darker pigmented people in whom redness may not be visible. So now I'm going to push your calves side by side to test for tenderness. And I am going to firmly dorsiflex your foot while supporting your leg in extension. You can see that your peripheral leg vein is symmetric in size and your limbs are not tender. And I don't see any abnormal deviations like tenderness in your limbs and swelling of one calf or leg. So now I am going to inspect the skin of your hands and your foot for color, temperature, edema, and for any skin changes. Okay, so I can see that the skin of your hands and foot um, is color pink, which is normal, and your skin temperature is not excessively warm or cold, and your skin texture is resilient and moist, and I don't see any presence of edema. And for abnormal deviations, I will see that your skin is cyanotic, and I will see that your skin texture is excessively warm and cold. And now I am going to assess the adequacy of your arterial flow for any arterial insufficiency. So I will now hold your hand and I will press at least one of your nails of both of your hands and your foot between my thumb and my middle finger to cause blanching for about 5 seconds. And after 5 seconds, I will release the pressure and observe how quickly normal color returns. Okay, so I can see that it immediately returns in color and I don't see any delay, which is a sign of abnormal deviation. And so we're done with this assessment. I am now going to document the findings in my record. Thank you, ma'am, for your cooperation.